Welcome to another virtual town hall held by the members of the Board of County Commissioners. I'm Dylan Blaylock with Clackamas County's Public and Government Affairs Department, and I'll be coordinating public comments for today's meeting. Joining us tonight is the full Board of County Commissioners, Chair Judy Smith, and Commissioners Sonia Fisher, Paul Savas, Martha Schrader, and Mark Schultz. My thanks to all of you for joining us. Thank you. Tonight's topic is suicide prevention awareness and mental health resources. The event will go until 7 p.m. or until we run out of comments and questions, whichever comes first. The session will be archived to YouTube for later viewing. We also have several guests with us today who are mental health experts from Clackamas County. I'll introduce them all in a moment, but first we're going to hear some welcoming comments from Clackamas County Chair Judy Smith. Madam Chair.
Thanks, Dylan, and thanks for our professionals for joining us tonight. All the commissioners are on this Zoom tonight, and they can make comments at the end. We'll call on you. Thanks for the members of the public joining us. We really want to hear from you on this important topic. Providing mental health services is very important to this board. If you look at the county's overarching strategic plan, Performance Clackamas, you'll see that the following language under our Ensure Safe and Healthy Communities reads like this, quote, "A focus on the well-being of all of our families and communities reflects the best of our character. Investments in providing services to those needing care, addressing hunger, homelessness, addictions, behavioral health needs, and reducing crime are key to making our communities safe," close quote. Primarily for tonight, my fellow commissioners and I are here to listen. We'll have an opportunity to provide comments at the end. Please know that you are not alone. If you need help, Clackamas County operates a 24/7 crisis and support line. That number is 503-655-855. Excuse me, I said that wrong, 655-8585, and can be found at this website, www.clackamas.us/behavioral health. And that link again is www.clackamas.us/behavioral health. And with that, Dylan, I'll pass it back to you. I'm going to ask all commissioners put your computer on mute, and I'm going to do myself right now. Thank you.
Thank you very much, Madam Chair. We also just put the number and the website that you referenced in the chat right now for all of our attendees. Okay, we have three guests who will join us and provide different presentations to get us started. Rebecca Ward is a crisis therapist with the county. She is a licensed practicing clinician working in mental health for over a decade. Rebecca works at the Clackamas County Mental Health Clinic and is part of Safe and Strong, a free service for people in Clackamas County who might be struggling with the mental health impacts of the COVID-19 pandemic. Gallie Murray is the county's suicide prevention coordinator, a licensed clinical social worker who has worked for Clackamas County for the better part of 19 years since completing her degree. Gallie works within the county health and various other systems in order to reduce Clackamas County's deaths from suicide. And Allie Linfoot is a peer services coordinator with the county and has worked in peer services for more than 2 decades. She is a person and a mom with her own mental health lived experience. Her work focuses on mental health and addiction issues affecting youth and young adults, children and families, and adults utilizing mental health and addictions systems. Our thanks to all three of you for being here. I'm going to add into the chat very quickly the links for Safe and Strong and for our suicide prevention page and our peer and family support services page. So everyone watching has those links. Now, the three presentations that we are going to hear, which should take us up to right around 6 p.m., are as follows. Just go ahead and let me share my screen. Okay. Mental health awareness, why it is okay to be having a hard time and what CLACO and other supports and resources are available. Suicide prevention awareness, how to ask the question, are you worried about a loved one and need help? This presentation relays what you can do. And peer support, engaging in mental health or addiction recovery is sometimes easier when you have an ally that has been through it. Clacko's peer support programs can provide that ally. This section answers, what is peer support? Does it work? And how do I access it? And as Chair Smith stated, please remember that Clackamas County operates a 24/7 crisis and support line. That's at 503-655-8585. Again, in the chat for anyone experiencing the need for help and those who are worried or anxious about themselves or others. And lastly, tonight we're only taking emails for questions and comments. We'll share my screen one more time. That's because we want to make sure that you all get the help you need if you want to talk to someone immediately. Since our guests aren't available, you can call the crisis line again at 503-655-8585. But if you are looking to pose a comment or send in a question for the panel, please email it to Clacko News, that's on the screen, at clackamas.us. Okay, and with that, we will go and move into our presentations, and we will start with Rebecca. So, Rebecca.
Thanks, Dylan. Mental wellness is never easy. It's difficult to talk about. It's difficult to understand. It's difficult feeling like you're a little bit different than everyone else. However, the reality is that battles with mental health are extremely common. Mental health challenges many of us. And just because people put on a brave face doesn't mean that they don't have their own struggles. There's a fear of being judged or causing people to act differently around you. However, chances are it just makes you more relatable. You and your friends and family will feel like they understand you just that little bit more. Give yourself permission to not be perfect. You, along the rest of the world, are dealing with a lot of variables, known and unknown. It is okay to not have an immediate positive reaction to them. Pay attention to your genuine emotions. Are you sad? Are you irritable, angry, frustrated, anxious? Have your sleep patterns changed? Label your emotions and then vocalize them. With this, you're taking a weight off of your shoulders when you're being transparent with your emotions. So when someone asks how you're doing, it's okay not to be okay. It's okay to take a break from the news and social media. Pay attention to how social media and the news are impacting your mood. It's okay to be still. Practicing quiet time is a great coping tool for anyone to use. It's okay to eat a cupcake. Your feelings and emotions are valid, no matter what they are. And it's okay to ask for help. Here at Clackamas County Behavioral Health, we have a variety of services to help you through challenging times. Most of these services start with calling our crisis and support line. You've been hearing this number. I'm going to say it again. It's very important. Our number is 503-655-8585. It's 24 hours a day, and you'll get a supportive person on the other end. I will repeat it again later too. We will screen for safety and can also find you support and services that are best suited for your situation. Our Urgent Mental Health Walk-In Center has had several names over the years. We have gone by Riverstone and Centerstone. We are now called Clackamas MHC, Clackamas Mental Health Clinic. We are a walk-in center for people in urgent need of mental health care. Everyone is welcome to use our walk-in center to engage with a mental health professional. Our services include brief counseling, safety screenings, case management, and referrals to other resources. Clackamas MHC offers peer-delivered services where individuals in need can get support from someone who has had experience and has knowledge on how to progress and support others. Oh yeah, sorry, thanks Dylan. There is a mobile team, if you want to scroll down. Perfect. So this team can come out to your home, your school, your local park or business, and talk and assess the situation. This team includes mental health counselors, case managers, and peers. If you want to scroll down one more. Within the sheriff's office, we have what's called a behavioral health unit, BHU. These counselors respond to calls that require law enforcement due to safety reasons, most likely, and they are dispatched directly from law enforcement. We also have our Clackamas Safe and Strong program, which was created as a response to the COVID-19 pandemic. This team offers services for individuals struggling with stressors related to the pandemic. And this can be in the form of emotional support, education, resources, whatever it's calling for. You reach most of these services except for the BHU by calling our crisis line. One more time, it's 503-655-8585. And I think we've put in the chat here the address to our walk-in center. We're located in Happy Valley. Our hours Monday through Friday from 9 until 7, and on Saturday 10 to 7. Again, that crisis line number is 24 hours. Thank you.
Thank you very much for that, Rebecca. Okay, and now we're going to go to Gallie Murray. Gallie.
Hi, everyone. Thanks so much for being here for this important conversation. You know, everyone has a role to play in the work of suicide prevention, so really happy to see folks here. So I'm going to talk a little bit about suicide prevention since that's my role here with the county. And the role of suicide prevention has historically belonged to mental health professionals, and at least, you know, that was kind of the working theory, although I would argue that that was never really the case. I'm here to tell you that this is no longer the responsibility, suicide prevention is no longer the responsibility of mental health professionals. And again, I don't know that it ever really was. And that all of us should have a role in this work. And you might be thinking now, well, oh, Gallie, I don't have the right credentials. I don't have the right training. I'm not a blank, fill in the blank. I'm not a counselor. I'm not a, whatever. And the good news is that you don't need to be any of those things. And that in order to make a difference in the life of someone else, there are free, easy, and quick things that you can do to make a difference and to actually save a life. And so, Dylan, if you bring up the slide deck, we're going to start the conversation by just debunking some myths around suicide. It's always kind of helpful to kind of start here. There's a lot of information out there in the world that a lot of it's accurate and credible, and some are myths that are kind of perpetuated on and on and on. So the first myth that I want to pop and debunk right away is that talking about suicide will put the idea in their head or will cause someone to feel suicidal. That is a myth. I can't say that enough. Talking to someone about suicide will put the idea in their head. That is a myth. That is not true. And actually, the truth is that talking about suicide actually reduces the stigma surrounding suicide and mental health. And it also allows for individuals to get the help that they need or want, rethink their options, and to share their story. It also signals to people talking about suicide, creating opportunities like this one to talk about suicide, signals to others that you can handle the conversation about suicide, that you're capable of holding space for someone who wants to talk about suicide, that doesn't scare you. So let's just debunk that myth. Talking about suicide actually causes folks to feel relief, like, oh, finally someone has said the word suicide. Someone is asking me directly about how I'm doing. Thank goodness. And now I can finally share how badly I'm suffering. The second myth is only mental health professionals have a role to play in suicide prevention and saving lives. And how I started this conversation is that's not true. We all have a role to play in this work. And one easy way to do it is to get trained. And I'll talk to you about that in just a second. But getting trained makes people feel confident and competent to do this work. And I'm telling you, it'll make you feel very different. If you haven't been trained, you'll feel like a different human being around being able to have these conversations because you'll have the tools. Myth number 3, And there's more myths than 3, but we're just going to do 3 tonight just to kind of touch the water. Most suicides happen around the holiday season in the winter. People will say to me, oh, Gally, we got to brace ourselves. The dark months are coming up. It's winter and the holidays are coming up and it's really hard. And that's when suicides happen. Actually, nationally and locally here in Oregon and in Clackamas, we experience the highest rate of suicide in the springtime. So again, a myth is suicides happen in the winter holiday season. That's not true. They happen highest in the springtime. All right, next slide, Dylan. So what we know is that to do this work, it's easy and it's free. People say to me a lot, I don't have a lot of time, Gally. I don't have education about being a mental health professional, but I want to get involved. I feel really passionate about this. Take a free training, a mental health awareness training or a suicide prevention training. They are free, and most of them right now are virtual. It's one of the silver linings of the pandemic, that these trainings can come right to your couch. You can be in your pajamas when you take these training. No one will even know. Go to this website, gettrainedtohelp.com. It lists all of the trainings that are offered, and there's a variety of trainings that range from 1 day, 2 days, or as short as just 90 minutes, an hour and a half, because we recognize that time, you all are very busy and time is very valuable. But in 90 minutes time, you can walk away with the additional skills on your tool belt as to how to have a conversation that might be really challenging, but you will feel confident and competent in having that conversation if you get trained. Another way to get involved in this work is put the Clackamas County Crisis and Support Line that Rebecca has given you and Dylan has put in the chat. And I'm going to tell you again, and Chair Smith talked about as well. Put that phone number in your cell phone. My guess, if you're like me, you have 1 or maybe 2 cell phones within your reach right now. Put the number in your cell phone if it's not already there. The interesting thing about being intentional about things like physical health emergencies is that we all, when we get our cell phones, 911 is already programmed in there for us. It's already there. We don't have to add it. That's about being intentional. That better prepares us as human beings to be better equipped if we come across someone who needs emergency help. What I'm asking you to do is be intentional about putting that crisis and support line in there, because if it's in your phone, then you are never without someone like Rebecca and her team to be able to walk you through a situation where if you encounter someone who's struggling, you don't need to know what the plan is. You don't need to know what to do. You just call professional help, which is this crisis line, and they will help you. So again, that number is 503-655-8585, 24/7. You don't need to know the right questions. You don't need to have a plan. You don't need to know the answers. That's the crisis worker's responsibility. They will help you. Last thing about getting involved is that if you see someone who's struggling, say something to them. Now, I'm not just talking about the people who you know, your family, your friends, people you go to church with, your spouse. I'm talking about people who you don't know too. I'm talking about when you walk down the street and you see someone who's visibly upset. Don't assume that someone else is going to check in on that person. Assume that you're the only person who's going to say to that person, hey, are you okay? And if we start treating people who are experiencing emotional distress, just like we experience people who are experiencing physical distress, the world would be in a different place. Imagine if we treated, everyone on this call today, my guess is, not even knowing all of you, is that if you encountered someone who fell down when you were going out to your car, if you encountered someone who fell down, you would rush to them and you would say, are you okay? You might even help them up. You might gather the things that they dropped and help them. And I say, are you okay? And chances are they are. On the rare occasion they say, no, I'm not. And maybe professional help gets called. So you call 911. Approaching someone who's experiencing an emotional struggle, emotional distress is no different. But yet we tell ourselves it's not our responsibility. I'm going to invade someone's privacy if I ask them if they're okay. We don't do that for someone who's having a physical health emergency. We think, well, if I ask someone if they're okay and they say they're not, what do I do then? So I'm just not going to ask. Someone else will deal with it. And that's where the crisis and support line comes into play. If you have that number on your phone, you are never without professional help. So the 3 things that you can do to get involved in suicide prevention, no matter your role, even if you don't have enough time, because we recognize people are really busy right now and really tired. Take a training, 90 minutes out of your day. There are trainings as soon that have capacity as soon as the first week of October. Put the number in your phone, put that crisis line in your phone. And lastly, if you see someone who's struggling, say something. Treat folks who are emotionally struggling just like you would treat someone who is having a physical health issue. Ask them if they're okay. Assume that you're the only person who's going to do that. Next slide, Dylan. So another thing that people ask quite a bit is, how do I have the conversation with folks? If I worry that someone is suicidal, how do I do it? And again, taking a training, something like Question, Persuade, Refer, QPR, which is the 90-minute training and free, virtual right now, walks you through how to do something like this in a non-rushed way, like we're going to be tonight. But here's kind of the take-home points. Reach out to someone who you believe is struggling. And I'm not just talking to people who you think might be suicidal. I'm talking to people who might just be upset. Check in with them. But for folks who you do think might be at risk of suicide, or who you know to be suicidal, talking with them is really important. The number 1 step is that you have to ask the question. Here in Clackamas County, we have sweatshirts and t-shirts and all of these things that say, ask the question. And people say to me, well, what's the question? Well, the question is, are you okay? That's the main question. But the question also should be, are you having thoughts of suicide? Are you planning on ending your life? Are you thinking about ending your life? It's really important to use the word suicide. We can't dance around it. We can't say things like, are you thinking about hurting yourself, and being kind of tentative? Are you thinking about, that? We have to call it what it is. We have to say, are you having thoughts of suicide? Are you thinking of ending your life? Because guess what? If we can't talk about it, then the people who are struggling with those thoughts, they're not going to be able to talk about it too. Because what it does when we shy away and we say things like, you're not thinking about killing yourself, are you? What we do is we signal to people that we can't handle it. We're not ready to have that conversation. And so people don't talk about their feelings, and then people end up suffering alone and in silence. The follow-up questions to, are you okay? Are you having thoughts of suicide? Could be the questions here on the screen. Things like, do you actually have a plan to end your life? Do you have access to what you need? Do you have the lethal means to carry out your plan? Something like pills or a firearm, something else. And then, do you know when you're going to do it? You said you're thinking about it. Do you know when you're going to do it? Do you know when and where? Now, these questions I recognize are not for just anyone to ask. People have different levels of comfort, and you may not feel comfortable asking these questions, and that is okay. The important thing, though, is to make sure that we get the person who we're worried about to someone who can ask those questions. Again, cue that crisis line number, which is probably already in your cell phones because you've already put it in there. The people at the crisis line, any crisis line, can walk you through these questions. You do not need to know the answer to these questions. You just need to know that you have a spidey sense in your gut, follow that gut feeling, or you have known evidence that someone has told you they are suicidal. Next slide, please, Dylan. Next step is to listen. And this is really important. Don't take what they have to say and don't pass judgment on it. Don't interrupt. Take what they have to say seriously. Encourage them to say, like, how long have you been feeling like this? How long has this been going on? Next step is encourage action. So things like, have you thought about getting help? Have you thought about calling the crisis line? What have you done in the past to get through this? What's worked? What hasn't worked? How can I help you? And even things like, it might be useful to connect with someone who can better support you. Maybe a doctor, a mental health provider, a peer support specialist, which Allie will talk about here in a moment. You can even say, like, I can help you figure it out. The biggest thing to tell people who are struggling, and those of you who have struggled, and we all have as human beings, you know that sometimes it's really hard to ask for help. And then once you decide to ask for help, sometimes it's hard to navigate getting help. And so one of the best things that we can give to people who we care about or who we're trying to support is say, can I help you do this? Can I help you navigate this? Can we call the crisis line together? Can we call your doctor together? Can I go with you? I'll wait in the lobby if you want. How can I help you? You are not alone. So first step, ask the question. Are you okay? Are you having thoughts of suicide? Use the word suicide. You have to use that word. If you don't feel comfortable using that word, find someone who does. That's okay if you don't. Next step, listen. Don't pass judgment. Don't interrupt. Don't make assumptions. Take them seriously. Last but not least is encourage action. Ask, what would be helpful? What do they think would be helpful? What could you do to be helpful? And let them know they are not alone. Next slide, Dylan. So that's a very, very brief summary of how to have these conversations and what you can do to get involved. And again, I hope that if this conversation leaves you with something, it leaves you with, you can play a difference in this work. You can play a part, no matter what your role is. We know that in the nation, nearly 100% of people would take action to help someone close to them who was thinking about suicide. And my guess is that you all are part of this group. We also know that for every single death that occurs, 24 people attempt suicide for each death, and they live. So every death we have, 24 people attempt suicide and live. And those are the folks who we need to wrap around with hope and encouragement and support and let them know they are not alone. For every one person who dies from suicide, 278 people seriously consider it but do not die. Thoughts of suicide are very, very, very common. There's a lot of stigma around suicide and thoughts of suicide, and we sometimes think, well, if people are having thoughts of suicide, that means that there's no hope for them, they're going to die. And actually, thoughts of suicide are very common. The important thing is to get people help and resources in the way that feels useful to them, and to let people know they're not alone. Reaching out, saying hello, making connections, that is the work of suicide prevention. And that is something that we can all be a part of. Thanks very much.
Thank you very much, Callie, for that. Okay, and next we are going to go to Allie Linfoot. Allie, go right ahead.
My name is Allie, and I'm the Peer Services Coordinator for Clackamas. And I was hired nearly 11 years ago to come in and work with our community to build a peer services system for people to access. So first of all, what is peer support? Oh, Dylan, if you want to pull up those slides, that'd be great. Peer support, those are support services that are offered to people that are struggling with mental health and or substance use and addiction. These are peers are people who are in recovery from their own struggles and mental health conditions. Peer-delivered services have been shown to be extremely effective as an addition to traditional treatment or as an alternative to treatment. Many times people are skeptical or nervous about accessing formal mental health treatment. There's a lot of stigma that surrounds mental health. And so sometimes peer support is a way to access help without feeling that stigma that can occur for people. Peer support services are designed by peers for peers. As Dylan mentioned when he introduced me, I have my own lived experiences, and I have experience raising a child who has had his own experiences. Next slide, please. So what do peer support specialists do? Like I said, they are people who self-identify as having these lived experiences. They share those lived experiences with the people they're supporting. And this helps people to experience some hope, build some hope. They see this person who has had these same struggles and see that they are doing well, that they are experiencing success, that they are happy in their lives. And this helps to bring that hope back. And what we don't talk about enough is the suicidal thoughts that can come for those experiencing addiction. And mental health may not be their primary struggle. It may be substance use. And with that, hope can be lost very quickly. It's very, very difficult to get clean and sober, especially when you reach the point of being homeless or not having a job. You've lost your family, you've lost your children, you've lost all of these things, and that just depletes your hope. And so working with a peer who has overcome their addiction, is working, who has gotten their children back out of foster care, has gone on and gone to school and furthered their education, that brings hope to people. Peers promote a sense of belonging within the community. There's a whole community out there of people who are clean and sober, of people who are living with mental health issues, and they're living successfully. And finding that community and feeling that belonging is really, really important. It's important to find your people, find your tribe. Peer support services help prevent relapse, and they promote sustained recovery for mental health and substance use. It's a way to, for example, with addiction, you need to move away from those circles that maybe you've been a part of for so long, and you have to find those new circles, the healthy circles, and that's where that community piece also comes in. Some activities that a peer support specialist might engage in are, we do a lot of advocacy work. We help people find their voice so that they're able to also learn to advocate for themselves. We know that people, for example, coming into our crisis walk-in, they have an option there to work with a peer, to work with a clinician, or a combination of both. And those choices are really, really important. And it's really important that people get to voice to their team what they feel will work best for them. There's experiential sharing. So when I used to do direct service and provide support to people, we would eventually get to a place where I could share some of my experiences, and that would help us to maybe discover direction that the person I was supporting wanted to go, whether that be to further their education or try to build those bridges that may have been burned with their family members, those sorts of things. And so that sharing is really, really important. I talked about building community. Within the addiction world, again, the certification that peers get is specific to addiction, and they work on mentoring and coaching for people who want to stay clean and sober, and help them discover a path to do that successfully. We also work really hard to connect people to resources in their communities. And those resources could be, for example, if we're talking about people who have regular suicidal thoughts, there is a support group that we have in Clackamas County. It's called, and Dylan, I sent that flyer if you want to. I don't know if you can create a link in the chat or put it up, but it's called SLOP. And we named it that because life is sloppy, it's messy. And when you're struggling with your mental health and you're struggling with suicidal thoughts, it can be really tough. And SLOP actually stands for Suicide as a Language of Pain, because that's what it is. Suicide or a suicide attempt, it's not a selfish act. That's another one of those myths. For the person who's feeling that way, what it really is, it's an unselfish act. They are going to release the burden that they are putting on others. That's the thought that occurs often. So knowing that that's occurring, that's pain, and it's trying to escape that pain that often lead people to an attempt. So this support group is for those that have attempted. It's for those that have chronic thoughts. They may not have had an attempt, but they have chronic thoughts of suicide. And like I said before, it's for those that have survived an attempt. I have to say that group is the first in the state of Oregon, and we did it here in Clackamas, and arguably the first in the nation. We have not been able to find another one in the country. So that's pretty exciting, and it's been very successful. Peers also help people getting back into social circles, making connections with other people, which we often refer to as natural supports, which is what they are. It's connecting or reconnecting maybe with family members, with old friends. For somebody who really struggles with their mental health, at times that can become really uncomfortable for family members. It can become uncomfortable for friends, and sometimes they kind of move away, and you sort of lose touch. And so with recovery, rebuilding those bridges is important. Or like I said before, finding your new circles, finding your new people. And a peer can help with those introductions and those groups that are out there that somebody may be interested in joining. And then we help with system navigation. So for somebody who is in crisis, we may connect them with Clackamas's crisis walk-in clinic. We may help them navigate, how am I going to pay for this? I don't have insurance. Oh, okay, well, let's look at what the resources are out there. Let's get you enrolled. Let's get you attached to a mental health service if that's what a person is looking for. In Clackamas County, peer support services are free. You do not have to have insurance. You do not have to be attached to treatment. You can access peer delivered services from anywhere for any reason. And so the systems navigation piece is also really important for people who may be coming out of care at the state hospital or in some sort of residential setting. And so having a peer to help people kind of navigate coming back into their community and restarting their lives is really important to have that support. Next slide, please. I will share a little bit of data with you all. So we've had these systems set up here since around summer of, 2011. And I just put 3 years worth of data in here, 2017, 18, and 19. We know 2020 was kind of an anomaly, and the way that we do peer delivered services in 2020 was very, very different than how we've done it the last 10 years. So that's why 2020 is not in here. We served in 2019 almost 6,000 people in peer delivered services alone. Some of those, about 2,000, used peer delivered services only to start their journey towards recovery. And the other group of people were mostly, or they were all using formal mental health or addiction treatment and peer delivered services together. The one-on-one peer, that's with, it's kind of self-explanatory, but one peer working with one person, because we also have lots of groups and drop-in centers in Clackamas that occur. So just the one-on-one support, we had about 4,100 people take part in 2019 in one-on-one services. And then our drop-ins that I mentioned, we have several. This includes both our youth drop-in centers. We have 2. One is for all youth and one is for LGBTQ+ youth. And we had about 1,600 people participating in those drop-in centers and getting support that way. Had about 2,000 different support groups and workshops for individuals that were using peer delivered services. And then It's really important for peers to make sure they're keeping up their skills and getting trained. And so the rest of the data is around that, making sure that those staff have the opportunity to increase their skills. Next slide, please. And then this is the experience of services for Clackamas citizens that have used these services. We have a great engagement rate. In 2018, it was 78%. In 2019, it was 71%. And that is an amazing engagement rate for a mental health or addiction recovery service. 82% in 2019, 82% reported that they did have an improved overall wellness. And that means whole health. That's not just their mental health, not just their addiction recovery, but also felt that their physical health had improved. And that could mean that a peer helped them connect to a primary care doc that they did not have and maybe hadn't seen one in a very long time, and the peer helped them to get connected. We had 86% that reported that they felt their quality of life had improved because of peer delivered services. And we let the person define what their quality of life should be. And that is an important point to make, because what I think somebody's quality of life should look like may not be what they think their quality of life should look like. So it's important that they define that for themselves. We had 70%, this is just in 2019, increase their natural supports. And these natural supports are so important because formal services are not always going to be there. There does reach a time when you're supposed to be kind of winding down from doing mental health services or winding down from using peer support. And that's why we try to put these natural supports in place for people. I want to stop and talk about acceptance in their community. That is a really, really important data point that we look at, because we know that people who feel accepted do really well. And for the first 6 or 7 years that I did this work, and I have 10 years of this data, I'm just showing you 3 years worth. Those numbers for acceptance were really low. We were like 30, 40%, somewhere in there. And I really could not figure out, how do we bring that number up? What is it that we're not doing? And what I did was I put my head together with Gally, with a couple other people within behavioral health who do health promotion and other prevention work. And I kind of had a light bulb moment. And I thought, it's not up to us as the people with the mental health condition to make you accept us. It's up to us to educate so that the community understands what it's like to live with a mental health condition, what it's like to live with an addiction, and we can gain acceptance that way. And within about 14, 15 months, that number went from 40% up to 70%, which you see there in 2017. And that was through working with my colleagues to educate librarians, to educate law enforcement, to educate small businesses that are in our community. And it comes through recognizing when somebody is in distress, understanding what to do when that happens, to ask the question, and then to know where to go when somebody says, no, I'm not okay. Yes, I'm thinking of killing myself. And so getting that education out there was super, super important. And then we have in 2019, we had about 66% of people report that they would have returned to a higher level of care if they did not have a peer to help support them. And what that means is they may have ended up back in jail. They may have ended up in the hospital. They may have ended up in some kind of residential setting. But with peer support, they were able to avoid those other services because they had that support. Suicide prevention and supporting somebody through suicidal thoughts is really just inherent to peer support and how peer support is provided. We call it sitting in discomfort. So if somebody tells us that we are, that they are thinking of suicide, often for peers, it's sitting and listening. It's time then that we stop talking and we start listening. And then we talk, then we're able to help the person decide, what do we want to do? Do we want to call the crisis line? Do we want to go to the walk-in center? Do you want to access your provider? I can help you do that. But with peers, it's the listening part, and not judging, and just sitting in that discomfort. I think that's all I have. Thank you.
Thank you so much for that, Allie. And thank you all, Allie, Gally, and Rebecca, for those presentations. Okay, and now if you are looking to pose a comment or send in a question, again, you can email it to claconews@clackamas.us. I'm putting that in the chat now. We received several questions before and a few during the presentation, so thank you very much. We are going to move on to those now. So the first one, when thinking about how community connections reduce risk for someone who might be feeling suicidal, older adults can be particularly vulnerable. What are the best practices in supporting older adults who might have limited family or medical clinical connections in the community? Are there tools available for professionals to access when working with older adult populations? Thank you.
I can start if you want.
Sure.
Yeah, it's a great question. Connecting older adults to a range of programs is beneficial for mental health and physical health outcomes. You know, programs that offer companionship, support, volunteer work to stay active, transportation are all really necessary for older adults. We also have specialists in older adult care that consult on complex cases, and they're on the state level and our county level. Senior centers are all around the county, and they not only offer a place to socialize, take classes, but have access to services within them as well. Most, if not all, senior centers also provide transportation to them. Let's see. There's a family caregiver support program through Clackamas County. It's a non-paid, it's for non-paid caregivers, so family mostly. And it provides like relief for the demands of caregiving, which are many. You know, that could include emotional support, educational classes, information, and access to other programs that are out there. A great way to get connected to many of these services, and there's tons more that I don't even know, is to contact the Clackamas County Aging and Disability Resource. And I can chat that phone number in. I actually have it right here. If anybody wants to add more.
Yeah, I'll add a bit more. So whoever posed this question, I really appreciate this question, because our older adult population is a population that is oftentimes invisible in our communities. And, you know, we tend to focus a lot on youth, as we should, but we need to be focusing on across the lifespan. And actually, when we look at who is dying more so than anybody else in our county, in Clackamas County, it is not our young people. And I say this with caution, that our young people are dying, and we hear about those deaths a lot. But what we don't hear about, who we don't hear about, is our middle-aged and our older adult population that is dying more so than any other age group in this county. So, and that has been historically true for our county for the past 10 years. Our middle-aged and older adults are who's dying more so than anybody else. So I appreciate this question very much. My first response is take a training. So mental health first aid, also known as MHFA, the link that I put in the chat, the Get Trained to Help website, it is not as common as the traditional mental health first aid trainings, but there is an older adult mental health first aid training that you can take. It is, it's similar to mental health first aid, but it talks specifically about the characteristics that come as we get older and the people who we love that are older adults in our lives. One of the things that is really important also is for folks like primary care offices and other folks to really be culturally responsive, for lack of better words, to our older adult population, which means I know that our primary care doctors have very little time, but rushing anyone through an appointment is really hard, but rushing our older adults through an appointment is troubling, when oftentimes the conversations that they're having and the stories that they're sharing are going to lead to perhaps why they're feeling lousy, both emotionally and physically. Other resources are the Senior Loneliness Line. So the Senior Loneliness Line is an amazing resource that allows folks to get calls into their home. So if I'm an older adult, I can get a phone call in from someone who is trained to just talk with folks, specifically older adults. And I can also call this line and talk with someone. It's called the Senior Loneliness Line. And I don't know, Dylan, no, you're right ahead of me, Dylan. I appreciate you very much. Dylan has put that in the chat. Lines for Life operates the Senior Loneliness Line, and it is a wonderful resource. I was also going to mention that we do have, like Rebecca said, we do have an individual both at the county level and at the state level who it is their job to support our older adult population, and part of their job is to have conversations, but also to provide training. There is one training around loneliness and the impact that loneliness has on us as individuals, but specifically our older adult population, and that loneliness ends up killing our older adults more so than a lot of things, because loneliness can be a terrible thing. And some older adults don't have anyone that calls them, no one visits them. And that can cause lots of physical health and emotional health symptoms. So yeah, I'll stop. But there are resources there. And again, we don't do a good job in our society bringing those resources to the forefront, but they are there and they are available to you. There's also an older adult peer that maybe Allie can speak to.
Yeah, I put a link in the chat, and that is to Mental Health and Addiction Association of Oregon. That is the peer organization that we contract with to provide peer support to older adults. That link, it'll give you information about the organization, but they also have a link to a referral form on there, and anybody can make a referral. You do not have to be a mental health professional. You could be a grandchild of the older adult, or a sibling of the older adult, and make the referral yourself to help try and connect them with the peer, or they can refer themselves. Yeah, we have peers that specialize in older adult work.
Okay, the next question is, or a comment, I guess. I strongly believe there needs to be some sort of support for parents and families of suicide attempt survivors. As a parent of a survivor, I was shocked at the lack of support for us who are supporting our kids/families through the recovery. Thank you. So it's just a general comment on the lack of support, I think.
I will comment on that is something that we have heard very clearly from our community and our local community here in Clackamas, but at a state level as well, that if you lose someone to suicide, there are a great deal of resources for you. And our county is known for providing one of the best resources after someone experiences a death of someone they care about to suicide. But if you have someone in your family or someone you care about who has attempted, those resources are for folks who are caring for those individuals and folks who are experiencing the attempt. They're not as plentiful as we would like. So we hear you. The resource that I would point folks to is NAMI. It is not specific necessarily to suicide attempt survivors or folks who are supporting those folks, but they do offer a great deal of support around family members who are caring for loved ones who are experiencing mental health conditions. Thank you, Dylan. He put the link in the chat. But we hear you, and hopefully that we will have resources to offer you in the near future about that.
There is also a virtual support offered to families of children, and I'll pull the link up and put it into the chat. OFSN provides it, and they do offer support virtually. pre-COVID, and hopefully after COVID, we will be doing more of that in person. But I will put that link in the chat.
Thank you, Allie, and thank you, Gally. Okay, next question. How does the county work with the local school districts for suicide prevention? Would like to do that.
I'll take it. So we work quite extensively with our county school districts. We have, for those of you who don't know, we have 10 school districts in this county. So we have a lot of school districts, and our school districts are doing amazing work, especially right now, given our current state of pandemic life. So shout out to all of the administrators and educators who are keeping our kids educated, and providing some emotional support for those little humans and big humans too. But so one of the ways that we support our schools is by offering a great deal of complex case consultation, which means if there is a school that is feeling like they need a little extra support around mental health issues, they readily contact with Rebecca's team at the crisis line. So that crisis line that I know is already in your phone, that is available to schools, and folks contact with me as well around students that are experiencing suicidal ideation or having attempt. I am very, very available to work with districts or schools around making sure that the transition plan for students coming back into a school is safe and adequate, that parents feel okay, that schools feel okay, and the student is ultimately getting what they need while being educated. The other thing that is not a well-known fact that's happening in the state is something that a piece of legislation that passed in 2019 called Addie's Act, also known as Senate Bill 52. And Addie's Act is essentially a state mandate that requires every single school district in the state of Oregon to train all of their school staff in suicide prevention, all of their school staff. Now this, as you know, districts, we have big districts, there are small districts and big districts. There's a lot of staff to get trained. And I have to say our districts here in Clackamas County have taken this to heart and have eagerly gotten their staff trained and are in the process of doing that. But they're doing a wonderful job, and training is available to them free as well. So Addie's Act says that staff will get trained. And then the other thing that Addie's Act requires our schools to do that we help with as well is it requires every district in the state to have a suicide prevention and intervention protocol. And for you parents out there, this may not be something that you know, but I'm here to tell you that each district should have, and each district in our community, I believe, does have a suicide prevention and intervention protocol. And essentially what that is that it walks a school through what their response is when a student comes to their attention that is expressing thoughts of suicide or says they're suicidal, what the pathway is to get that student support, what the screening process is when the crisis line is contacted, and what the steps are to take. So there are intentional steps of taking good care of our students if they have those thoughts of suicide, which come up in a safe place like school, because our schools are safe places for students most of the time. And we want our students to talk about suicide if they're having those thoughts like we've talked about. And school, our kids spend a lot of time in schools, and our schools are doing a great job of being ready to have those conversations. So we work a great deal with our schools. Rebecca, what do you want to add?
Yeah, I just want to add that it's very common for a phone call to come into the crisis line and we consult. It could be a counselor, it could be the counselor alone with the student without, all the varieties of different ways to do it. But we're here. No one is alone in the school, and no one is alone in the community. And we're not alone, right? We also consult with each other. So it all kind of comes together, and we're all trying to make the same goal as keeping everyone safe. And that number is not just for crisis, like in the moment, it's to consult with another professional that also has other professionals to consult with too.
All right. Thank you both for that. Appreciate that. Next question. I would like to see more resources available for people who are not severely mentally ill, but who need some help, Prolonged face-to-face therapy is so expensive that we rely more and more on medications, but it can take months to see a psychiatrist who can prescribe and monitor meds if one is available at all. I think if I were in a severe crisis situation, I could find immediate help, but for the day-to-day quiet desperation, help is hard to find and expensive. Thank you.
Rebecca, go for it. No, I'll follow you up.
I was just gonna say, yes. Help is really hard to find, especially in these times, as we've seen wait lists for clinics and individual providers have just gotten so long. Part of what we do at the crisis clinic, is we try to manage the crisis and get someone connected to ongoing services. And we see that as our team, the wait lists are just incredible. So yes, this is not just a one case situation. Waits are long and therapy can be expensive depending on how you're accessing it. Go through your insurance if you can, if you have insurance. That's what, hopefully it covers some kind of mental health. We can, at the crisis line, get you pointed in the right direction if you don't have insurance, if you qualify for Oregon Health Plan. They have a great program for mental health. If you're looking for a psychiatrist, that is hard. Psychiatrists have even longer wait lists. If you know that you're needing like depression medication and you already are connected to a doctor, your primary care doctor, talk to them first. If they're not able to help you directly, maybe they know of a resource that you could get connected with. There are, taking insurance out of it, there are sliding scale agencies. And if you need help getting connected to any of those, call our line and we'll get you connected the best that we can. We do know quite a bit of resources. We don't know them all, but we know quite a bit. Yeah, that's what I got.
I was just going to say too that it's a great place to start is to call the crisis line, because they really do have a lot of resources and they have they know about different providers that might be taking folks. They know about sliding scale fees that Rebecca was talking about. I also want to say, if insurance, if copays and deductibles are a barrier and you are struggling, please call the crisis line. Folks are not going to be turned away if they are in crisis and they are in need. They're going to work with you.
Very low barrier.
Yeah. So don't hear that insurance can be a barrier, because it definitely can be. But in Clackamas County, they have made it a way that the barrier as barrier free as possible. And I would echo what Rebecca said around, we really rely on our psychiatry team and our psychiatric nurse practitioners in the world to provide what we refer to as specialty medications. And specialty medications are typically medications that cannot be prescribed by a primary care doctor. And so if there is a primary care doctor that can prescribe medications for you, please see if you can go that route. And if, and maybe if you aren't already getting medications through your primary care doctor, ask them if they'd be willing to prescribe. And the answer might be yes, the answer might be no. But the important thing too is that we don't want you to be alone in your struggles, all of this set aside. So there are things like peers, like Allie has talked about. There's the crisis and support line.
I just actually put the phone number in the chat and a link to the David Romprey Oregon Warm Line, which is a peer-run warm line. I want to stress this is not a crisis line. This is a line where you can call and talk to a peer. They can talk to you for as long as you need to talk. You may not get somebody on the first call, but they will call you back. That's why this is not a crisis line. Also, something that I have heard that they do, this is something you can ask about too, is if you want somebody to call you and just check in with you regularly, call you every once a week and see how you're doing. Often they have peers on the line that will do that too, just to check in and say hi and see how you're doing.
Well, for that, it's a good segue into the next question because we were talking about prescriptions. The question is, I know you have a medication prescriber at the walk-in clinic. Do they fill prescriptions the same day that you walk in, how do you get connected to them?
Yeah, good question. I will start with this one. We do have a prescriber at our clinic. We have one prescriber. Since we are a short-term clinic, they are not able to see everyone that walks in the door. It's just not possible. The way that it works is you walk in and you're seen by a therapist as soon as possible. You know, most likely the same day. That's why we're a walk-in clinic. And the therapist then will assess what your needs are, what's going on. If you are able to be referred to our prescriber, I want to be clear though that even a referral to our prescriber doesn't mean you'll see the prescriber that same day. It most likely will not happen. Her schedule is very full and it's hard to sneak another one in there. So, you know, if you are looking for same day medications, unfortunately it's hospital or an urgent care, or even Zoom care. A place like Zoom Care Online has been doing great work with our folks over the last few months, 18 months, since COVID started. You know, you're seen online. They take some insurances and it is pretty low cost depending on what you're looking for. And you'd be able to be seen, have a psych eval that same day and possibly get a prescription if that's what's needed. But again, to get connected to our prescriber, she doesn't see everyone, and you would see a therapist first when you walk in, and you'd get assessed by that therapist and to see if you would get connected to our prescriber.
Excellent, thank you. And with that, we will go to, I think, our last question of the night that has come in, and after this, we'll go to commissioner comments, which we get through the answers here. Do peers require any special training? So I guess that's for Allie. Peers require any special training?
So yes, Oregon has a certification process, and we have a commission, a state commission called the Traditional Health Worker Commission. There are trainings have been approved through the commission. You must have taken a 40-hour approved training to become a peer support specialist. You can also take an additional 40 hours to become a peer wellness specialist. And peer wellness specialists, they have also a specialty in people struggling with mental health who also have chronic physical health conditions. And so they may help somebody, especially with a recent diagnosis, kind of struggling in acceptance, like with diabetes or heart disease. So they have special training in that. And then also for on the addiction end, there is the certified recovery mentor, which also requires a training course. Or you can also have peers that have multiple certifications because they have multiple lived experiences.
Okay. Thanks so much for that, Allie. And with that, that was the last question that we've received. So my thanks to Gallie and Rebecca for answering those questions. And I'd like to, Chair, I'd like to throw it to the commissioners if anybody would like.
Thank you, Dylan. And I really want to thank our panelists here. It's just been a wealth of information. When I was a commissioner last time around, I took the mental health class and it was a day and a half. Holy cow. And now we have a 90-minute video that can set us on our way. And I'm sure that video has links if we want to get more information. And I asked Gallie to send it to me and she did. And maybe I'll sit with a friend who does counseling in other areas to help with that. I'm thinking that video could aid us not just in suicide prevention, but in just how to talk to people in general. I think since we've been in lockdown for so long with COVID, that maybe some of us have trouble re-engaging. Not so much commissioners, we can talk all day long, but maybe some of the rest of us. So with that in mind, I'm going to call on my commissioners. Sonia Fisher, would you like to make some comments?
Thank you, Chair Smith. And I agree. Wow, what a great panel and amazing information and such insightful questions. I really appreciate everything that our community cares about. People that are struggling, we have a real heart in Clackamas County, and it's evident in the excellence and the values that we have in our community. So thank you so much. This is a conversation, it's a hard conversation. I really appreciate the comments of, especially about how it's uncomfortable if someone's in emotional distress to bring it up, kind of want to look the other way. And I really appreciate the analogy, Gally, about, people are hurt, we seek to help. Well, people with emotional challenges are hurting as well. So we can continue to learn and grow, and as a community, hold up everyone, and that includes those that are having challenges. And Chair Smith, oh my gosh, it's so true. We've just changed through these COVID-19 and not being as connected with other people. So as we emerge, as we recover, we can really embrace those opportunities to connect. So thank you.
Thank you, Commissioner Fisher. I appreciate those comments. Commissioner Schrader, would you like to make some comments?
Just unmuted. I really want to thank Allie, and Rebecca for the work you've done tonight. And I've been here for a while. And I know how hard we've worked in this county through many years to make sure that we have one of the finest mental health systems, I think, in the state. And I also want to mention that particularly our work with seniors, that we have received a national award from the National Association of Counties for the groundbreaking work that we've done with seniors who are lonely or facing difficulties or feeling alone. And being a senior myself officially, I can't tell you how appreciative I am of that, because as many of you know, I have sons here, but my daughters and grandchildren are in other places. And so trying to connect with them with FaceTime has been great in COVID, but it's been very difficult, I have to say, having them so far away and feeling as if that those I love the most with all of my heart, I've been isolated from. So I want to thank you particularly for the senior work that you're doing. I also want to talk a little bit about some takeaways I've had from this conversation. And that is, number one, you don't have to struggle in silence. There are people here that will help you not struggle in silence. You will have someone to talk to. You will have peer support. Please take advantage of it. You don't have to do your own inner work alone. Again, there's peer support. There's our programs. The inner work of feeling the pain of loneliness and depression and isolation. You really aren't alone. Take advantage of the services that we offer. Your now is not your forever. Okay, let's be honest with that. Having times when things seem really bleak and lonesome, and you just feel like you're on the precipice of kind of some big dark hole, really. I think that depression can get that deep, that it won't be forever. You have to work at it. You have to get the support you need. And finally, I'm just going to say, you will smile again. Okay, you will. You can come out of your depression and feelings of hopelessness and despair with the help that you have from the people you know and the people that are working so diligently, Gally and Allie and Rebecca in this county, to make sure that you have those resources. So thank you, staff, and thank you, Commissioner Fisher and Chair Smith and Commissioner Savas and Commissioner Schull.
Great comments, Martha. Commissioner
you.
Savas, you're up next.
Yeah, first of all, I want to thank our staff and everyone who joined us today for putting on really a great presentation. In my 11th year here, and every year we address mental health issues and suicide this time of year, and it's certainly a worthy cause, and there's certainly a lot of need out there. I can't remember who said it this evening. We are in extraordinary times, and this is an anomaly of sorts. And I certainly know that people are feeling, isolation. People are feeling stress. People are feeling disconnected, and I think that is creating a lot of unusual pressures, extraordinary pressures, and tension that otherwise you wouldn't feel. So I sense it more than I've ever sensed it before, and I think we all have to be somewhat patient, but I think we also need to connect with people. I'm not an expert here, and I don't know what isolation is how it's affecting the numbers and the stats currently during this pandemic. But it does feel like it's hurting a lot of folks. I do know there's a lot of people can't see their loved ones and so forth. The other thing I want to share, it was touched on, but I just want to expand on it, and that is there really is a shortage of trained mental health staff and specialists in the country, let alone, and worse here, frankly, in Oregon. And through some state laws, it's harder for anyone to transfer their license of practice from another state here. So it's not easy to hire people. There's a statewide shortage of that. And it's not that there's necessarily a lack of will to bring on or provide those services. The other thing I think that is I find difficult for a lot of people that want to enter this trade or this a career is that the cost of education certainly exceeds really what the pay is out there for this line of work. And so my heart goes out, and my appreciation for those who entered the field for non-monetary reasons to help others at the sacrifice of maybe a less fruitful career as far as income levels. I mean, people sacrifice a lot to do what they love, but they don't necessarily do it for the compensation they would otherwise get in different trades. So a lot of just a lot of recognition and appreciation for those who do this work. So thank you all, and I'll pass it back on to Chair Smith.
Thank you, Commissioner Savas. You bring up some really excellent points. Commissioner Scholl, you're up.
Yes, good evening, everyone. And thank you, Dylan, for an excellent town hall once again. And Rebecca, Gally, and Allie, thank you very much. You were very informative. We all are vulnerable at times in this life to feeling down. And at those times, we need somebody to talk to. It's not weakness to need help. And reach out for help. And if you are available, reach out to be helpful. The road ahead may look hopeless, but it's not. Someone has lived through life experiences, and they can help you. No one in the world can be you, and the world needs you to be the best you can be. If you know a veteran who needs help, have them contact our Veterans Affairs Council. And in addition to the other points of contact that have been mentioned here this evening, Clackamas County is here to help, and no one in this county need feel alone. Thank you very much, and good evening.
Thank you for Commissioner Scholl. Well, again, I thank staff. I thank the participation of my commissioners. This is good work. It's good information, and I'm sure it'll get out to the people who need it. I know I learned something. I always learn something in these venues. Dylan, thank you for your patience in hosting this, and we'll see you next time. Goodbye.
Thank you, everybody. Have a good night.